Hello, everybody. We have a couple more folks hopping on. We'll get started in about 30 seconds. Okay, doctors, go ahead. Dr. Martin.
Welcome, everyone. Good afternoon. Governor Lee, you've called on Tennesseans to do their part to exercise personal responsibility in the fight against COVID-19. And now again, we join to ask you to do the same, sir. 163 days ago, on July the 6th, more than 39 Tennessee physicians who represent thousands more warned you, Governor Lee, that getting COVID-19 under control would require your leadership. We've asked repeatedly for a mask mandate and other interventions so that Tennesseans can safely go to work, provide for their families, and send their kids to school. But Governor Lee, you've rejected the pleas of your healthcare experts. You've rejected the pleas of President Trump's White House COVID-19 task force, and you've rejected repeated evidence generated from within our own state showing that masks and other safety measures are effective. And instead, you've dumped the burden of leadership on municipalities, individual businesses, teachers, and parents, leaving them to fight this global pandemic on their own. And sir, with all due respect, the result of this fend for yourself approach speaks for itself, unfortunately. According to the COVID-19 tracking project, earlier this week, Tennessee ranked first in the nation in new cases per 1 million populace per day, achieving a case rate that is nearly double the national average. As of yesterday, COVID-19 hospitalizations in the state of Tennessee were at an all-time high, over 2,800. As of yesterday, COVID ICU admissions in the state of Tennessee are also at an all-time high, over 700 ICU patients with COVID in the state. Most importantly, COVID deaths in Tennessee for the last 7-day period recently hit an all-time high yesterday at over 530. Who's bearing the brunt of this sorrow? It's rural Tennessee. Rural Tennessee, where mask mandates are not in place, is suffering worse than the larger metro areas where mandates exist. Rural Tennessee, without mask mandates, is accruing 129 new cases per 100,000 populace per day, as compared to just 83 cases per 100,000 populace per day in large metro areas with mask mandates in place. And while these numbers tell a story, they're incredibly sad. They also sound a little sterile. They don't begin to describe the epic human toll that is being paid every day by patients and healthcare workers across the state. I live it as an intensive care unit physician. Just last week, I'll never forget it, I had a sweet elderly man, as I'm dressed in this plastic spacesuit, weep on my shoulders and beg me to help him because he still had things to do, he said. Last week, I witnessed numerous patients calling their loved ones to say goodbye, just in case, as we set up to put them on a ventilator, because you don't know if you're going to come off the vent or not with COVID-19. Can you imagine getting that phone call from your mom or your dad or a grandparent or, God forbid, a child in an intensive care unit? It's happening every day in Tennessee. And when patients do die, despite our best efforts, family members are often left to say goodbye over an iPad. I will forever be haunted by the sound of wailing family members, one in particular, as I hold up an iPad in one hand and hold the dying patient's hand in the other. And so your healthcare workers are not complaining. We're not complaining about the hard work. We are lamenting the seemingly endless but preventable sorrow that Tennesseans are experiencing on a daily basis. While the vaccine gives us hope, we fear that the worst is still ahead based on the large case counts we're currently experiencing. The large case counts will be more logs on the fire in the coming weeks. Will we be able to meet the demand? We're going to try, but resources are not unlimited. There are already examples of the system buckling under the pressure. A colleague of mine, a fellow critical care colleague, Dr. Matt King, recently reported that he received a patient from Kentucky this week, and that outside hospital had looked for an ICU bed across the region from Louisville to Lexington, Cincinnati, Western Virginia, Birmingham, Nashville, all before finally finding an ICU bed in Sumner County, Tennessee. And this experience is being repeated all over the region right now. Tennessee, you deserve better, and we can do better. Governor Lee, you've said time and time again that the only way to manage this crisis is through personal responsibility. But we ask you, sir, where is your responsibility in this matter? We need you to issue a mask mandate. Mask mandates work. Counties with them are faring better than those without them. And counties without them undermine the progress of those that do make the sacrifice to implement them, generating larger case counts and further stretching hospital capacity. We ask you, sir, to make the Tennessee Pledge stronger by requiring employers to implement it. Requiring businesses to keep people physically spaced and to wear masks. Confidence in businesses and confidence in schools is the way to keep them open and thriving. And finally, sir, we ask you to make sure that our schools and businesses who have the support they need to stay afloat during this financially trying time. I'd like to introduce two of my colleagues as well to share their thoughts on the matter. We'd like to start with Dr. Isaac Thompson, an infectious disease expert.
Yeah, thanks, Jason. It's unfortunately very easy to summarize the current situation in the pandemic right now because it's by far the worst that it has been since the pandemic began. Every aspect, every metric is the worst since the COVID-19 pandemic began. And we have utterly and completely failed to contain this virus. We have failed to contain this pandemic. And it's despite knowing ways to effectively contain it, we have failed. And I think that's what's so heartbreaking and so frustrating about this. We know that masking and distancing and avoiding unnecessary gathering, we know these things are effective. We have seen examples of other communities and other areas do this, and we are failing. And a large driver of that failure lies with state leadership and a lack of a mask mandate and a lack of clear communication about how this is so crucial. Cases are absolutely surging, as Dr. Martin mentioned. We're either first or second almost every day this past week in weekly new cases. Hospitalizations are surging. Hospitals are full, they're overflowing, and hundreds of Tennesseans are dying every day. It's a natural disaster every day, and we're opting into it every day. We're opting into a new natural disaster where hundreds of Tennesseans are dying. We know what to do about it, and we aren't, and it's frustrating. And I think that my heart goes out to my colleagues on the front lines, my critical care, emergency department, hospital medicine colleagues who are doing this every day, and they're all fantastic, but they're outmatched and they're outnumbered. And when a hospital is overwhelmed, it's an issue that trickles down to all issues, not just COVID-19. And an analogy I'm fond of is a sports analogy. This is a big football state. You can take 2 or 3 of the best defenders in the history of football and you put 2 of them on the field. How are they going to do? It's a losing battle. You're outmatched, you're outnumbered. It doesn't matter what your skill is. And so we're allowing that to happen. The vaccine data that we have, the vaccine news is incredibly hopeful. It is clearly our path forward, our path out of this, but it's still in the distance. It's going to be weeks to months before that effect is seen on the level of hospitalizations and new cases across the general population. And we have to act in the meantime because hospitals can't remain overwhelmed or there are not going to be enough people to receive the vaccine because we're going to have too many unnecessary deaths. So I'll pass it on to Dr. Lyons for thoughts from the front lines. Thanks.
Hi, I'm Dr. Lyons. I'm one of the emergency medicine physicians in Middle Tennessee. I thought Dr. Martin did an excellent job summarizing how case counts have skyrocketed in Middle Tennessee. What I want to do is give you an idea of what a day in the life of an ER doctor looks like, what we're seeing, and how COVID has been affecting our daily life. So I thought I would do that with a couple of cases that have happened in the last week. In the last week, Most hospitals and ERs in Middle Tennessee have become completely full. And in just the last few shifts, we have noticed that it has gotten worse. My first example is a COVID positive individual who needed a medical bed. Their oxygen levels were low and they needed that extra support. Unfortunately, there were no hospital beds at my hospital or any in Tennessee, and ultimately I had to transfer that patient to Kentucky to receive care. The second patient on that shift was a critically ill patient having a diabetes complication that required an intensive care bed. Again, unfortunately, we did not have any intensive care beds available anywhere in my region or in Middle Tennessee, and the patient ultimately spent 10 hours waiting in the emergency department for an available bed. Whereas the normal length of stay for a critical patient like that would be as soon as possible, usually 1 to 2 hours to get the care that they need. Another patient a colleague recently had was a COVID positive individual who needed a critical care bed, was at risk of being put on the ventilator. There were no beds anywhere in the state. We looked in Kentucky, there were no beds available. We looked in Northern Alabama, no beds were available. It has really reached a critical point where we're not able to provide the care that these patients need. We've now had to look at sending people home with oxygen instead of admitting them to the hospital because we don't have anywhere to put these patients, unfortunately. I've also had non-COVID patients that are greatly affected that need a higher level of care. For example, in some of the more rural settings, we don't have neurosurgery at that facility. We typically send these patients to some of the tertiary care centers in Middle Tennessee. I had a patient recently diagnosed with a new brain tumor that I was unable to find a bed for. And it took quite a bit of begging and pleading from a hospital in order for them to make room for this patient. I'm really honestly nervous and concerned about what the next 6 weeks look like, knowing that our case counts continue to climb, and knowing that, again, Middle Tennessee and Tennessee in general has now reached the highest growth throughout the United States. The time to act has passed us. We have to do something now or patients' care will suffer. I firmly believe that a mask mandate would help, but we also have to socially distance. With Christmas coming, I know we all want to spend time with our families. We all need to make some sacrifices here. I know that it's hard. It's hard on all of us healthcare workers and our families. Unfortunately, that's what this Christmas looks like. The vaccine, again, I think that it is a blessing that we have a vaccine as soon as we do. We will need people when the opportunity comes up. We will need people to be willing to take that if their doctor thinks that it's safe for them. We also need to get this vaccine to healthcare workers as soon as possible. We are losing all types of healthcare providers to this illness in terms of being out for long periods of time. We need your help, Governor Lee.
Thank you, Laura. Appreciate that. I'd just like to close by reiterating a few quick points. Hand hygiene, wearing a mask, and remaining socially distanced are the quick keys to knocking this back in the short term until the vaccine can gain traction. You know, a bedrock value in our state is the belief that we all have a responsibility to each other. We are the volunteer state. We can beat this together, but we need leadership. And so, Governor Lee, when you have your COVID briefing tomorrow, I'll hope that you'll speak to how your leadership is going to change in the coming weeks. Please tell us how you're going to keep us safe. Please work with us to defeat COVID-19.
All right, with that, we'll open up the line for some questions. Feel free to put it in the question box or raise your hand. It looks like our first question is from Blake Farmer. Blake, you are unmuted. Oh, let's see.
Excuse me. Sorry, I didn't realize I had to unmute myself. My apologies.
We got you now.
I got a question for Dr. Thompson and one for Dr. Lyons. Dr. Thompson, I imagine that you have heard about the state holding on to those initial doses that they've gotten from Pfizer on the vaccine. And, you know, it sounds like no other state is doing that. Is there any explanation for not getting those to, even some hospitals who aren't on the list to get some of the initial inoculations? Any reason you can see that would happen?
Yeah, so one of the challenges, it's all really complicated and it's all moving very fast, and there's really no protocols for any of this, right? Everybody's figuring it out in real time. One of the really difficult things about the Pfizer vaccine is that its requirement for extreme cold storage, and the handling is really crucial, and the shipments come in doses of 975, and they can't really be divided up easily and allocated. And so there are a lot of healthcare facilities, for example, that have employees who desperately deserve, as much as any employee of any other healthcare center, to get vaccinated in that first wave. But if it's a small institution with fewer than 975 doses that gets that shipment, then there may be some that go to waste. And so it gets into a really complicated discussion of resource allocation. That is not my particular expertise, and I don't know all the details that went around the decision from that single initial 975 dose shipment. I do know that as the others are arriving essentially today into tomorrow, and they're going to be widespread allocated throughout the state to medical centers that are large enough to accommodate those 975 dose shipments. Hopefully, as we learn more about how the vaccine can be stored and handled, and as other vaccines hopefully soon come on the market that have a little bit less stringent cold storage requirements, we will be able to blanket the healthcare workforce that they need. So I think it's really tough. I don't have the sense that anybody thinks that a healthcare worker at one facility deserves it any more or less than another. These are frontline providers. It's crucial that we figure out how to get that allocated. And there certainly seems to be no indication for holding on to these or stockpiling anything for a future time where it's needed. The doses are needed now. And hopefully those logistics can be worked out really soon.
That's great. Well, then one question for Dr. Lyons, and that is, with what you all are seeing, I mean, I hear these stories about particular patients being turned away. I guess what I don't want to overstate hospitals turning away patients. I mean, it sounds like there's sort of at this point always a way to find a place for someone, even though they might have to travel or something. So when do we get to a place where you're saying there's no room in the inn kind of a thing?
We will never turn a patient away from an emergency department. Healthcare is protected federally by law that you will always be seen in the emergency department. With that being said, wait times will suffer. You may wait hours to be seen by a physician, but we will never turn anybody away. We would never send anybody home in a situation that we didn't feel was safe. I hope we never reach a point where we have to start making decisions that truly we've never had to make before in terms of who has the best chance of surviving. But truly, that is why we have to act now, because all of the numbers are heading in the wrong direction.
Thanks.
Okay, looks like our next question is from Stephanie. Go ahead, Stephanie, you should be unmuted.
Hi there. My question was kind of somewhat addressed already, so I'll defer this to Dr. Martin. How do you feel about those first 975 doses being held? Should they have been distributed? I know it's hard to pick and choose who they go to, but should they have gone ahead and gotten to the hands of some of these frontline workers? And then also, neighboring states seem to have already been administering this for a couple of days. Why is Tennessee so late in the game on this? And is that a concern?
Yeah, as Dr. Thompson alluded, the logistics are complicated, but I can tell you the vaccine is needed immediately, right? I mean, so if there's, and I don't know all the reasons that went into the decision for holding that 975 back, but if any of it was to create a rainy day stockpile, let me just tell you, there's a hurricane blowing. We need the vaccine to be administered and distributed as quickly as possible, because really time is potentially lives for frontline providers.
All right, perfect. Next question is from Rachel. Rachel, you should be unmuted.
Yeah, thank you. This is Rachel Wagner from the Tennessean. Other than, of course, the speedy, efficient rollout of the vaccine and a statewide mandate on masks, are there any other measures that you hope the governor will take to make things better, to get us to that point where the vaccine is starting to push numbers down?
I can quickly answer that, just to say that, I mean, I think people listen to their elected leaders, and I think the voice of leadership holds a lot of weight. And what a mask mandate would do is not just to hopefully enforce the mask, but also send that message of how crucial and how important this is and what a dire situation we're in. And so I think other messaging along those lines, to this, the data that we've talked about today, the information, I think what I crave from our leadership would be a statement to say, we are in a dire situation. Tennessee is one of, if not the worst state in the nation right now for COVID cases. That needs to be owned, and it needs to be addressed, because it's true. It's the situation. This is a natural disaster every day. And so we need to take this seriously. I haven't heard enough urgency. I haven't heard enough desperation from our leadership to say, well, this is a crisis and we need every person in this state to play ball and to do what these things that are effective that we've talked about. So I think the messaging is probably just as important, but I think what a mask mandate would do would also be to send that message in sort of an action speak louder than words type of way.
Thank you.
All right. Looks like we have one follow-up question from Blake. Go ahead, Blake.
Listen, I hear a lull. I'll just step right into it. But Dr. Lyons, I wanted to hear more about what you're seeing with patients. I mean, I think are you in Gallatin? Is that right?
Sumner County, yes.
Okay. Yeah. I mean, you all had so many cases early on and got that sort of first test. And I guess, Dr. Martin, I think you're there too, right? But what's different now compared to those patients? I imagine at the time there was so much unknown. Now we know more. Does it mean you're mostly dealing with sicker patients or younger patients, or how would you sort of compare what's going on now, even if it's the same numbers as you might have been seeing in those early days when the nursing home was evacuated? Like what's different? Maybe what's more concerning?
Yeah, early on we had a huge surge in the nursing home population, and that was the brunt of our cases. We of course still saw a small amount of community spread, but it was usually pretty easily traced to, I work at a nursing home, I visited so and so at a nursing home. Now what we're seeing is somebody comes in off the street, even may have said, I've been following all of the instructions, I've been wearing my mask, I'm here with a fever, and we do a COVID test and it's positive, and they do not have any clear idea of where they got the virus. The community spread has skyrocketed. So not only are we still dealing with some of the elderly population who are at much higher risk of having more severe disease, we're also seeing young people get the disease, most of which do well. Unfortunately, we have had several young people who we did not expect to get as sick as they did. And you just don't have any way to predict who is going to get sick, who is going to have mild symptoms and recover without much difficulty. It's really been completely across the spectrum. There's more cases as well, far more than we had in spring. This is by far the most COVID cases we have seen throughout the entire pandemic.
And did I hear you, or maybe it was Dr. Martin, say that you all were even starting to have to send patients home, maybe who were doing okay, but still needed oxygen?
It's something that we have started to explore due to concerns about capacity in Middle Tennessee. I personally have not done this yet, but we have made arrangements to do so if we need.
Blake, another thing that feels different right now is just the overall mentality of managing this patients. At the beginning of a pandemic, we didn't have any therapeutics. We didn't have a lot of evidence to guide our therapy. And so there was a lot of loss of life that sort of felt inevitable. The loss of life that is happening now is totally preventable. We know how to prevent it. Wear a mask, stay home, wash your hands. And it's devastating and maddening to see the loss of life just increasing, seemingly without end, when we know what to do.
Thank you all. I'll hush now.
All right. Well, I know all of you all have to get back to work and your patients. And so, Dr. Martin, if you want to close us out, we'll follow up the call with the recording for the recorders on the line. But Dr. Martin, feel free to close us out.
Yeah, I just wanted to say thank you for your time today. And Governor Lee, we respectfully implore you to lead at this time. And we would like for you to issue a mask mandate, make the Tennessee Pledge stronger by requiring businesses to participate. And let's make sure we support our schools and businesses with financial assistance when necessary. Thank you.